As of recent, there has been heightened concerns regarding the rising number of reported suicide cases gripping the country, and the local office of the Pan American Health Organization PAHO is elated to lend a helping hand. At a brown bag meeting with the media on Friday, PAHO country representative Dr. William Adukro called for a collective approach at addressing the issue of suicide. He added that at present the approach that exists appears to be disjointed.
I think we need to galvanize everybody, even if it's a national consultation. So now everybody who is doing something in suicide, let us all meet one day. Let us plan who is going to be doing what, who is going to be doing where, and how is it going to be done, what are the resources needed. Otherwise, we'll have all these things everywhere.
The need to decriminalize attempts of suicide was also highlighted. Under the laws of Guyana, one can be charged for attempting to take his or her own life. The PAHO country representative believes that suicide is an inherent problem and more help is needed to make a difference. Minister within the Ministry of Public Health, Dr. Karen Cummins, acknowledges that suicide is something that cannot be swept under the carpet. Having already identified the problem, Dr. Cummins agrees that concrete actions must be taken.
The primary care level at the health center, that's the first line. We doctors, and we can recognize those signs, and we have work in the community. The mantra of public health is healthy people and healthy communities, and so we need to pay attention to the community. And so I'm wondering if at the stations, you have your blood pressure checks, these vital signs, and the screening, we should maybe have one for mental health screening too. And so right there we can clip it in the butt.
Psychiatrist Dr. Harry is of the opinion that cultivating a culture of expressing love can bring about some amount of change.
If we can start there, it is going to make a difference. The other thing is, we do not talk with each other at home. The child goes to school, the child comes back home, and we say, yeah, good, going to school, she's going to school, everything all right. But we don't sit and talk with our children. We don't ask them how things going, how this, how that. We don't give them the opportunity, we don't give them the opening to get to us.
Dr. Harry added that a way must be sought after as to how to get people to change the way they treat each other. For Minister of Public Health, Dr. George Norton, suicide is one big, complex issue.
It's not going to be Ministry of Health. It's not going to be Ministry of Education. It's not going to be the social worker. It's got to be all of us. And I cannot support more when Dr. Harry stood up and says, he spoke about we, and I think he means Guyanese, because we are up in the top of the world, and we should love each other more. And that it begins at the level of the home.
There are plans afoot to have mental health introduced at the tertiary education level for teachers. Handel Duncan, HGP Nightly News.